Welcome to Lesson 5 of the Captain Surgery CPC Exam Preparation 2026 series from KS Medical Coding Academy. In this lesson, we're going to learn about the global surgical package. We'll cover the different global periods, including 0-day, 10-day, and 90-day periods, and understand what services may be included in the surgical package. We'll also discuss routine postoperative care, services that may be separately reportable, and important modifiers used in global surgery situations. A key point for this lesson is that global surgery rules can vary by payer, so our discussion will focus primarily on Medicare global surgery concepts. Our main CPC workflow is global period right pointing arrow included services right pointing arrow exceptions right pointing arrow modifier right pointing arrow verify. By the end of this lesson, you'll have a clear framework for approaching global surgical package questions on the CPC exam. Let's begin Lesson 5, Global Surgical Package, 2026. Before we begin, let's review the objectives for Lesson 5, Global Surgical Package. We'll learn the Medicare Global Surgery Indicators 000, 010, and 090, understand what services are generally included in the global package, and review routine postoperative care. We'll also learn how to identify services that may be separately reportable and understand the role of important global surgery modifiers. Our CPC workflow is global period right pointing arrow included services right pointing arrow exception right pointing arrow modifier right pointing arrow verify. Remember, global surgery rules can vary by payer, so the Medicare concepts in this lesson should not automatically be applied to every payer. For 2026, CMS identifies the Medicare Global Surgery Indicators 000, 010, and 090 for applicable procedures. And our key principle is, don't ask only, is it in the global period? Ask what service was performed and whether a reporting exception applies. Let's begin. What is the global surgical package? Now let's understand what the global surgical package means. The global surgical package is a Medicare payment concept where payment for certain surgical procedures includes specific related preoperative, surgical, and postoperative physician services. For applicable procedures, the package can include the surgical procedure itself, certain preoperative services, routine postoperative visits, and related postoperative care during the applicable global period. Medicare identifies three important global surgery indicators: 000, 0-day global period; 010, 10-day global period; 090, 90-day global period. These indicators help identify the applicable Medicare global surgery period for a procedure. But here's an important CPC point. The global package does not mean that every service provided during the global period is automatically included. Certain services may be separately reportable when specific requirements are met. For a CPC question, use this thought process. What surgery? Right pointing arrow what global period? Right pointing arrow what service? Right pointing arrow related or unrelated? Right pointing arrow included or separately reportable? And remember the overall workflow. Global period right pointing arrow included services right pointing arrow exception right pointing arrow modifier right pointing arrow verify. Understanding this basic concept will make the modifier and postoperative care questions later in this lesson much easier. Now let's look at the three important Medicare global surgery periods: 000, 010, and 090. First, 000 represents a 0-day global period. It applies to certain endoscopic and minor procedures, with no postoperative days. Next, 010 represents a 10-day postoperative period. The procedure day plus the 10 postoperative days results in an 11-day calendar period. Finally, 090 represents a 90-day postoperative period. For applicable major procedures, Medicare includes 1 preoperative day, the procedure day, and 90 postoperative days, making a total of 92 calendar days. Here's the CPC common trap. Don't confuse the global period number with the total number of calendar days. Your memory rule is simple. 000 equals 0 post-op days. 010 equals 10 post-op days. 090 equals 90 post-op days. When answering a CPC question, first check the global indicator, then identify the applicable period, and only then analyze the service. Remember, check the indicator right pointing arrow, identify the period right pointing arrow, analyze the service. These are Medicare global surgery concepts, so always verify the current payer-specific rules when coding professionally. Now let's look at what is generally included in the Medicare Global Surgical Package. For applicable procedures, the package can include certain related preoperative services, intraoperative services, routine postoperative visits, and postoperative care during the applicable global period. Postoperative pain management performed by the operating physician is also generally part of the global surgical package. The important point is that we should think of the global package as a complete care concept. Related pre-oxygen monophosphide care, right pointing arrow surgery, right pointing arrow routine post-oxygen monophosphide care, right pointing arrow related global period services. Here is the common CPC trap. Everything provided after surgery is separately billable. That is incorrect. Routine postoperative services related to the surgery are generally included when they fall within the applicable global period. However, specific circumstances can allow separate reporting, so never make the decision based only on the date of service. Your CPC memory is pre-op right pointing arrow surgery, right pointing arrow post-op, right pointing arrow pain management, right pointing arrow related care. The key rule is know the global period, right pointing arrow, know what is included, right pointing arrow, check for exceptions, right pointing arrow verify. For 2026, CMS continues to use global surgical packages for applicable Medicare procedures, including 10-day and 90-day global periods. Now let's look at services that may be separately reportable during a global surgical period. Being inside the global period does not automatically mean every service is included. We must first identify the service and determine whether an applicable exception exists. For example, an unrelated E/M service may be reported with modifier 24 when the requirements are met. A significant, separately identifiable E/M service may involve modifier 25 when applicable. When an E/M service results in the decision to perform a major surgery, modifier 57 may apply. A related, unplanned return to the operating or procedure room may involve modifier 78. And an unrelated procedure performed during the postoperative period may involve modifier 79, when the requirements are satisfied. Here's the CPC common trap. It's inside the global period, so it can never be billed separately. That's incorrect. Instead, ask, what service was performed? Is it related or unrelated? Is it included, or does an exception apply? Then determine whether a modifier is supported. Your CPC workflow is global period, right pointing arrow, identify service, right pointing arrow, related OR, unrelated, right pointing arrow, included OR, exception, right pointing arrow, modifier if supported, right pointing arrow, verify. And remember, don't use a modifier just to make a service separately payable. The documentation and coding rules must support it. Now let's focus on postoperative visits. Routine postoperative visits related to the original surgery are generally included in the Medicare Global Surgical Package when they occur within the applicable global period. When reviewing a postoperative visit, ask 5 questions. Is the visit related to the surgery? Is it within the global period? Is it routine postoperative care? Does a reporting exception apply? And finally, what is the correct coding? Routine follow-up examinations, recovery monitoring, wound evaluations, and routine postoperative management are examples of care that may be included in the global package. However, an unrelated E/M service may be separately reported with modifier 24 when the service is truly unrelated and documentation supports it. A related postoperative procedure requiring an unplanned return to the operating or procedure room may involve modifier 78 when applicable. Here's the CPC common trap. Every postoperative visit is automatically included. Not always. The key is to determine why the patient was seen, whether the service is related to the original surgery, and whether an applicable exception exists. Your memory rule is routine plus related plus global period equals generally included. For 2026, always verify current Medicare and payer-specific requirements before coding. And remember the key rule: don't code the visit based only on the date. First determine why the patient was seen. Now let's connect the global period with important surgical modifiers. Modifiers provide additional information about a service, but they should only be used when the clinical circumstances and documentation support them. For global surgery situations, remember these key modifiers. Modifier 24, unrelated E/M service during a postoperative period. Modifier 25, significant, separately identifiable E/M service performed on the same day as another procedure or service, when the requirements are met. Modifier 57, the decision for major surgery. Modifier 58, a staged, planned, or related procedure during the postoperative period. Modifier 78, an unplanned return to the operating or procedure room for a related procedure. Modifier 79, an unrelated procedure during the postoperative period. Here's the CPC common trap. Just add a modifier because the service occurred during the global period. That's incorrect. A modifier should never be used simply to bypass an NCCI edit or obtain separate payment. The documentation and clinical circumstances must support the modifier. Your CPC workflow is: identify global period, right pointing arrow, identify service, right pointing arrow, related or unrelated, right pointing arrow, check the exception, right pointing arrow, select modifier if supported, right pointing arrow, verify. For 2026 Medicare coding, always verify the current NCCI policies and applicable captain guidance. And remember the key rule: a modifier explains a valid coding circumstance, it does not create one. Now let's understand the difference between related and unrelated services during a global surgical period. A related service is connected to the original surgery. Routine postoperative follow-up, recovery monitoring, and routine wound evaluation may be included in the global package when the applicable rules apply. An unrelated service involves a different condition that is not connected to the original surgery. An unrelated E/M service during a postoperative period may be separately reported with modifier 24 when the requirements are met and the documentation supports the service. For a CPC question, follow this decision path. Global period, right pointing arrow, what service was provided? Right pointing arrow, related to the original surgery? If yes, check whether the service is included and whether an exception applies. If no, check whether separate reporting is supported and whether the appropriate modifier is required. Here's the common trap. The service happened during the global period, so it must be included. Not necessarily. The reason for the service matters. Remember, related does not equal always included. Unrelated does not equal automatically billable. Your CPC memory is: related, right pointing arrow, check global package. Unrelated E/M, right pointing arrow, consider modifier 24. Then verify. The key rule is: don't code based only on when the service occurred. Code based on what the service was for and whether the rules support separate reporting. Now let's look at an important 2026 special point for global surgical coding. When you see a global surgery question, don't focus only on the modifier. Start by verifying the global indicator, the applicable global period, the service performed, whether it is included, and whether a valid exception applies. Also make sure the documentation supports the coding decision and check the current Medicare and NCCI requirements. Another important concept is transfer of care. When surgical care and postoperative management are divided between physicians, Medicare uses modifier 54 for surgical care only and modifier 55 for postoperative management only, when the applicable requirements are met. CMS guidance addresses the use of these modifiers when care is transferred between physicians. Here's the CPC common trap. A modifier automatically makes the service separately reportable. That's incorrect. A modifier must be supported by the clinical circumstances and documentation. It should never be added simply to bypass an NCCI edit or obtain separate payment. Your CPC memory is: global indicator, right pointing arrow, global period, right pointing arrow, service, right pointing arrow, exception, right pointing arrow, modifier, right pointing arrow, verify. For 2026, remember, current rules plus documentation plus correct modifier use. And the key rule is: a modifier explains the coding circumstance, it does not create one. Let's apply the global surgical package rules to a CPC scenario. A patient is within a 90-day global period following major surgery. The patient returns to the same surgeon for a routine postoperative visit related to the original procedure. The coder reports the E/M service separately with modifier 24, simply because the visit occurred on a different date. Should modifier 24 be reported? No. Modifier 24 is used for an unrelated E/M service during a postoperative period. A routine visit related to recovery from the original surgery is generally included in the global surgical package. CMS also requires documentation supporting the unrelated nature of a service reported with modifier 24. Here's the common trap. Different date equals separately billable. That's incorrect. The date alone does not determine separate reporting. For the CPC exam, remember, 90day global period right pointing arrow postoperative visit right pointing arrow related to original surgery right pointing arrow routine post-oxygen monophosphide care right pointing arrow generally included. When you see modifier 24, ask 4 questions. Is it an EM service? Is it during the postoperative period? Is it truly unrelated to the original surgery? Does the documentation support that relationship? Your final memory rule is 24 equals unrelated EM, not any EM during the global period. So remember, global period plus related routine post-oxygen monophosphide visit equals generally included. Global period plus unrelated EM plus supported documentation equals consider modifier 24. That completes our CPC scenario and common trap. Let's summarize Lesson 5, Global Surgical Package. First, remember the Medicare Global Surgery Indicators, 000, 010, and 090. Next, identify the applicable global period and determine what service was performed. Then ask whether the service is related or unrelated to the original surgery, and whether it is included in the global package or qualifies for an exception. Important global surgery modifiers include 24, unrelated EM. 25, significant, separately identifiable EM. 57, decision for major surgery. 58, staged or related procedure. 78, related unplanned return to the operating room. 79, unrelated procedure. Remember the 3 CPC rules. Global period does not mean everything is included. A different date does not automatically mean separately billable. And a modifier does not automatically create payment. Your final CPC workflow is global indicator right pointing arrow global period right pointing arrow service right pointing arrow related OR unrelated right pointing arrow included OR exception right pointing arrow modifier if supported right pointing arrow VERIFY. For 2026, always use current CPT, Medicare, and NCCI guidance and make sure the documentation supports your coding decision. The final rule to remember is know the global period right pointing arrow identify the service right pointing arrow check the relationship right pointing arrow look for an exception right pointing arrow use a modifier only when supported right pointing arrow verify before coding. That completes Lesson 5, Global Surgical Package, 2026. Excellent work, and let's move on to the next lesson in our Captain Surgery CPC exam preparation series.